been nearly 3 months now since the Trump administration granted broad exemptions to the HHS contraceptive mandate. And ever since, Planned Parenthood has been deceitfully attacking the move. One of Planned Parenthood's repeated talking points is that a reported 58% of all women who use the birth control pill rely on it, at least in part, for something other than pregnancy prevention. You may have heard this yourself. Perhaps a doctor has told you the only way to treat your endometriosis or polycystic ovarian syndrome or another condition is with the pill. But we recently spoke with a doctor who tells us about another solution, one that does not include putting hormones or devices into a woman's body, destroying fertility, or violating one's conscience. Take a look. Dr. Lorna Cvetkovich is a Catholic and pro-life practicing obstetrics and gynecology doctor and Napro technology medical consultant at Tepeyac OBGYN, the largest fully pro-life OBGYN in the U.S. Thanks for being here.
Thank you.
Many women claim that they need birth control not to prevent pregnancy, but to treat things like endometriosis, for example. Is that true? Is birth control the solution for that?
No, sadly, it's actually the opposite. Certainly birth control pills rarely have their place, but for the most part they actually prevent the practitioner from getting down to actually making a specific diagnosis and a specific treatment. So one prime example is endometriosis. The average time from when a woman first goes to the doctor with bad pain to the time she gets diagnosed is 7 years. And so part of that is because it works as a pretty good Band-Aid. So you can quickly, easily get somebody out of your office, their pain is addressed, but their real problem is never addressed. Same thing with bleeding issues. You know, it's very typically given to teenagers who are having bleeding problems. And if you actually asked some of the authoritative reproductive endocrinologists, they'll tell you, well, no, if you put them on the pill at that point, you actually inhibit or impede their pituitary gland and their ovaries from learning how to work together. So it really rarely has a place.
Why is there so much misinformation on this, and how do you respond to that with birth control being so widely prescribed as a pro-life doctor yourself?
Right. Well, I think the only way to respond is just show that you can practice without it. And I think for people who have been through a traditional OBGYN program, it takes some time and effort to actually do that. But there are ways, and again, it just mostly goes back to good medical practice, finding what the problem is and addressing it specifically. But the reason it's so overwhelmingly promoted is that the doctor knows, okay, it's going to solve the problem, but also the patient won't be pregnant. And so there's an assumption that every young woman needs to be protected from pregnancy.
Let's talk about one of those ways to actually treat one of these conditions, Napro technology. That's just one way. What is that exactly?
You know, it sounds a little fancy, but actually it's just the application of the charting of natural family planning to gynecologic problems, including infertility, but also including bleeding problems and other things. So you're using the chart to give you information about the woman that you would not have.
Making observations about themselves.
Correct, exactly. And then beyond that, you also strive, again, you do things to treat the disease as opposed to, well, let's just say IVF. You don't really have to worry too much about why the couple is infertile. You just take them through IVF and get a baby, get a pregnancy. Whereas with Napro technology, you would do a very thorough investigation and try to find out exactly why. And then using both medical and surgical treatments, you would correct those things so that they can get pregnant on their own.
So Napro technology helps you to identify the underlying conditions. Is it a treatment in and of itself?
No, it's not really treatment in and of itself, but especially for things like male infertility, it may be one of the only things other than IVF that you have to offer, because timing and making sure the female half of the equation is perfect are the two things that are going to possibly allow a couple with male infertility to achieve.
You know, we're speaking about infertility, and so many women, I think about 10% of women of pregnancy-bearing age struggle with infertility, and Napro technology, NFP, can help with that.
I think it also helps because it really is a reality check for the person, because they can see right there what's going on in their own body, and they can interpret that in some ways. And also it's a reality check in that not everybody is going to get pregnant, and once in a while it's good to be able to witness and see why. You know, it brings them down to, it kind of gets rid of, sometimes it gets rid of the question of why.
So when do you recommend women begin utilizing Napro technology? When should they start charting, and how do they do that?
You know, there's a lot of different answers to that. If you see it as in more broad sense as something that just is very good for women's self-knowledge, or for the ability to identify early medical problems, then you could say that maybe even 13, 14, 15, you could start charting. In fact, there's actually a teen abstinence program. It's not called that. It's called Teen Start, but it uses the charting to demonstrate to the young woman that she knows her body, she understands it, and if she can identify when she's ovulating, no one is going to be able to convince her otherwise. Plus, it also embodies a lot of self-respect, which is really the reason why a lot of young women get involved in unfortunate relationships anyways, because there's a lack of respect.
And that self-awareness is empowering.
It's very empowering.
Thank you so much. Thank you so much for being here.
Thank you.